Thank you, Peter. It's a pleasure to be here representing RANZCO, which is the Royal Australian New Zealand College of Ophthalmologists, the peak body for eye surgeons in both Australia and New Zealand. The initial talk I'm going to give before we get on to some more academic subjects is just to give you an overview of RANZCO's reach and plans strategically for the coming 3 years, and describe somewhat the relationship that's been very strong, but it continues to evolve with the All India Ophthalmological Society. I have no financial disclaimers, and my thanks goes to Nitin Verma, Kristen Bell and Justin Morrow for all the work they've put into this 2030 and Beyond project, which is the centrepiece of our strategic plan moving forward. There are 6 pillars to Vision 2030 and Beyond: service delivery, workforce and training, Aboriginal and Torres Strait Islander healthcare, and there is a New Zealand version of that too with Maori and Pacifica Care. Global health, eye health, which I'll talk a little bit more at the end when we discuss the relationship with our Indian colleagues, and preventive eye care and sustainability. Why Vision 2030 and Beyond? It's an effort to get some equity into eye care in both Australia and New Zealand, and closing the gap not only for First Nations people but also for those in socio-economically challenged positions and less regional centres. It entails sustainability in both healthcare delivery and workforce. There are in fact 2 plans, one for both Australia and New Zealand, which are independent geographically. In Australia, we have Indigenous communities impacted at 6 times the rate of blindness that the rest of the population is. We have an ageing population with comorbidities, particularly the epidemic of diabetes. Maldistribution of services limits our access. We have long wait lists and under-resourced public ophthalmology, so similar problems to which most countries are trying to do battle. RANZCO has led stakeholder engagement to improve the patient journey. Key priorities are basically development of collaborative care models, and these are prioritised under visual disorders in children, diabetic eye disease, cataract, AMD and glaucoma. These pathways will entail telehealth and telemedicine and cooperation with our optometric colleagues. Working groups have been established and stakeholder engagement has been underway. Our stakeholders are many and varied, as this busy slide illustrates, both from a government level, from patient representative groups and other organisations such as Optometry Australia and Orthoptics Australia. We will continue to advocate for Indigenous eye health and workforce solutions. Closing the gap has proven to be the holy grail in Australia. We've struggled for many years with enormous efforts in terms of money, but little to show in terms of outcome. We're hoping to identify areas for collaboration and partners to solidify these outcomes, with our key resource always being our fellows who provide a workforce pro bono which is dedicated to the equity of eye care. New Zealand has similar problems with an ageing population, increased demand on services, growing wait lists, and a First Nations equivalent in terms of Maori and Pacifica communities that's underserviced and inequitably dealt with. Previously there's been no national eye health plan. The New Zealand plan creates trust and shared decision making, trying for these equitable outcomes which are so hard to get, and a sustainable ongoing process. A key advocacy success in New Zealand, which is in advance of Australia in some respects, is the establishment of a national eye health network with leadership from RANZCO fellows. Priorities here include governance structure, development, a short and long-term plan, suitable data collection to define the problems, service gaps prevention and screening programs, collaborative arrangements, and the ever-present difficulty of workforce issues. Relationships with government are always fraught in that there's a turnover, and with a recent election, new ministers need to be brought into the fold if the plan is to be successful. We have peak body collaboration and joint advocacy activities, including children's vision advocacy, ongoing. We're collaborating with our New Zealand optometric colleagues to try and find the best working models moving forward, and meeting, as I mentioned, with the new government ministers responsible. One significant gain has been the development of a national score so that people qualify for government-funded cataract surgery at a similar level of impairment throughout the country. Immediate priority is workforce, addressing regional shortages, funding for New Zealand training posts, and ongoing efforts to strengthen the Māori and Pacifica health workforce, as we're doing in Australia. I'd just like to finish with a few minutes on global eye health, where RANZCO is very active, particularly promoting support for South Pacific Island nations, and this is an area of cooperation with the All India Ophthalmological Society. Pacific is an area which is underserved and inequitably served, with significant rates of blindness and visual impairment. 90% of this vision is avoidable or treatable, and it's the same culprits: cataracts, uncorrected refractive error, and diabetic retinopathy. The prevalence of vision loss will markedly increase over time, and we have rapidly growing and ageing populations, and another issue with diabetes control as well. Urbanisation and the climate crisis will add to the dilemmas. Government should recognise the burden from diabetes, include eye care and human relation plans, integrate eye health in national plans. It doesn't seem to come as a priority, and invest in data collection. RANZCO's focus will be this region moving forward with our overseas commitments and aid, with an emphasis on supporting PAC Eyes, the local providers in the region, coming up with a plan that incorporates hubs for surgical teams and ongoing education and training. We're supporting advocacy in the lead up to the CHOGM, which will be in Samoa later this year, trying to engage governments at all levels and strengthening our collaborations, as previously mentioned, with the AIOS, American Academy, APAO, IAPB, and other not-for-profits. We're promoting fellowships and observerships, and I would flag to you the Global Eye Health Workshop in Adelaide at the end of October this year, and we'd love to see anyone from India there who's interested in this area. RANZCO extends that standing invitation to all stakeholders to contribute to the plan, and we look forward to strengthening an ongoing relationship with AIOS in the future.